Hello, I'm here today with Val AMSTADT of the Campbell County Health, along with Katie Jacobson with the Campbell County School District. And they're here today to talk a little bit about a new thing actually going on in Campbell County called the Kid Clinic, if I can get that out in one sentence. I guess let's talk a little bit about what is the Kids Clinic.
Well, the Kid Clinic is a school-based healthcare center.
Okay.
It was started as a project with the school district and Campbell County Health to bring medical services and behavioral health services to students. Back in 2008, Campbell County School District was awarded a Safe Schools Healthy Students grant. And in that grant, we began providing behavioral health services for students. And about halfway through that 5-year grant process, we realized we needed to do something to sustain those services because we were seeing exponential increases in students needing behavioral health. And school-based healthcare centers really seem to be the way to go as an opportunity to sustain that opportunity and grow and expand to provide medical services in addition to the behavioral health services.
Okay.
Yep, and the Kids Clinic is the very first school-based healthcare system here in Wyoming, and one of the very only school-based healthcare systems that offer healthcare and behavioral health services to a whole district.
Okay.
As well.
And when you're talking about healthcare and behavioral services, I guess go a little bit further detail. What exactly does that mean, especially probably the behavioral side?
Well, behavioral healthcare includes individual and family counseling for our students, and then their siblings from age 2 and up. Well, actually, any student in the county can receive services, whether they're a Campbell County school district student or they attend private or homeschool.
Oh, okay.
But behavioral health is mental health services, individual family health counseling, as well as substance abuse counseling services and evaluations.
And on the medical side, we offer well child visits, sports physicals, we do sick visits as well. We do walk-in appointments, and we do you can come and make an appointment with us as well.
Okay, great. And obviously this is a kind of a group effort here between Campbell County Health and the school district. Talk a little bit about how you guys staff this, I guess.
Well, the Kid Clinic is entirely staffed by Campbell County Health employees. We have 3 counselors that are here. 2 are part-time, 1 is full-time from behavioral health services, as well as a case manager from behavioral health services. And then on the medical side,
we have a physician assistant, which is me, and then a nurse as well. And we deal with the same case manager as the behavioral health does.
Okay.
And then the Kid Clinic also employs a full-time receptionist and a clinic supervisor.
Okay, great. And now if somebody does want services, say there's a student out there that needs services, how does that work? I guess do the parents contact you, or do the kids kind of initiate that? How does that work?
There's kind of multiple ways to access the Kid Clinic. If you are seeking behavioral health services for a child, the route that we would like you to go is to work through your school counselor and have a referral made. If parents are uncomfortable working with their school counselor, or if the child, say, attends John Paul II where there isn't a school counselor, they can contact Student Support Services, which is myself or my coworker Jessica Diaz. Our phone number is 686-7198. We process those referrals. And then on the medical side,
we have, you can either walk in to come and see us. We always require that a parent is with the patient for the first visit. At that point, they can sign a parental consent form, which allows the patient to be seen without the parent here if they get sick at school. So if they get sick at school, they go to the school nurse, and the nurse thinks they need further medical care. We offer transportation from the school to here. However, the parents have to specifically sign a consent for transportation as well. But then they can get sent to us from the school. We can see them, and if they're okay, they can go back, or the parents would have to come pick them up from here.
Okay. Okay, great. And I guess also I know you guys have like a mobile unit. You want to talk a little bit about that?
We do. Through the initial grant that we received from HRSA, we were able to acquire a big RV. And in that RV, we're able to provide both medical and behavioral health services. Primarily right now what we have been able to use it for is things like the Campbell County Junior Football Association. We were there Tuesday, Thursdays, and Saturdays providing some medical care if kids get injured on the football field.
Oh, okay.
We've also been at soccer tournaments, and we're always looking for opportunities to utilize it. We've taken it down to do dental screenings down at Cottonwood in Wright. we're just always looking for unique ways to reach our students and provide them some extra services.
Sounds great.
Exactly. And in the future, we're really hoping that once a month we can try and hit different schools and go to different schools during the day to offer medical and behavioral health services to them during the school day as well.
Okay, great. And I guess also, why should a parent or students use this service? Why is this a great service versus some of the other options out there?
Well, this service is actually really good because, you know, if a family is unable to pay, we do offer different services with our case managers, set up different opportunities for them to get help in order to pay, but we do not turn anybody down here for inability to pay. On top of that, we offer outstanding medical and behavioral health services, and I feel that Campbell County really, for the kids, is underserved, and we really need to get more behavioral and medical services to the children. So this is a way to do it, and a way to kind of, I guess, expand the medical care in the behavioral health field here in Gillette.
Okay.
You know, another good reason why someone would want to use the Kid Clinic is it's a great integration between the school and a student's overall well-being. And so we can really connect and have contact with the student's school, their school nurse or their school counselor or their classroom teacher, to really kind of combine what does the student's need or even what does the family's need, so that we can keep that kid in school, so we can help them to be academically successful, and increase our graduation rates and our success rates in school. So it's really a good integration of all kinds of services.
Oh, interesting. Yeah, it's great that Campbell County is able to do something like this, being the first.
We're the first in the state.
Yeah.
We're really
very
excited about that.
Yeah, great. Now, if somebody is, I guess, interested in contacting you guys, I mean, you're located in Hillcrest, or the old Hillcrest Elementary. Talk about hours, and I guess, are you guys open just the school year, or how's that work?
Nope, we'll be open year-round. On our end, we're open 8 to 5, Monday through Friday. You can get a hold of us by calling us at 688-8700. We're at 800 Butler Spaith Road, so the old Hillcrest, like you said. So.
Okay, great. Anything else you guys would like to touch on?
I don't think so.
I think that's
covered it all.
Okay, great. Thank you.
All right, thank you.